What if your body has been trying to warn you about something serious, but the signs were so common that you simply ignored them? A little stomach discomfort, losing a few pounds without trying, feeling tired all the time. Many people over 60 assume these changes are just part of getting older. Others blame stress, indigestion, or a busy lifestyle. But in some cases, persistent symptoms like these deserve medical attention because they may be linked to a more serious underlying condition. It helps control blood sugar by producing insulin and plays an important role in digestion by releasing enzymes that help break down food. The challenge is that pancreatic cancer often develops quietly. In its early stages, it may cause few or very subtle symptoms. That's why it's important to pay attention to changes that don't go away or can't be easily explained. Now, it's equally important not to panic. The symptoms we'll discuss today can also be caused by many other conditions, such as gallstones, stomach ulcers, liver disease, diabetes, infections, or digestive disorders. Having one or even several of these symptoms does not mean you have pancreatic cancer. However, if they are persistent, getting worse, or occurring together, they should be evaluated by a healthcare professional. In today's video, we'll go through 8 possible warning signs that adults over 60 should never ignore. We'll explain what each symptom may mean, why it can happen, and when it's important to seek medical advice. Early evaluation doesn't always lead to a cancer diagnosis, but it can help identify health problems sooner when treatment may be more effective. Stay with me until the end because the last symptom is one that many seniors dismiss as just getting older, even though it can sometimes be an important clue that something isn't right. Welcome to Dr. Bilal, where we make medical information simple, practical, and easy to understand so you can take better care of your health after 60. Now let's begin with the first 2 warning signs. Remember, these symptoms do not automatically mean pancreatic cancer. Many common health conditions can cause similar problems. The key is to pay attention when symptoms are persistent, unexplained, or continue to get worse. Symptom number 1, persistent upper abdominal pain that may spread to the back. Many people experience stomach pain from time to time, often because of indigestion, gas, or something they ate. But pain related to the pancreas can feel different. Some people describe it as a deep, aching pain in the upper abdomen that may gradually spread to the middle of the back. It may come and go at first, but over time it can become more frequent or more intense. For some people, the pain becomes worse after eating or when lying flat on their back. Sitting up or leaning forward may temporarily make it feel a little better. Of course, stomach pain has many possible causes, including acid reflux, stomach ulcers, gallstones, muscle strain, or digestive problems. However, if you have persistent upper abdominal pain that lasts for several weeks or keeps returning without a clear explanation, it's important to speak with your healthcare provider. Your body is sending a message, and it's worth finding out why. Symptom number 2, unexplained. Weight loss. Have your clothes suddenly become loose, even though you haven't changed your diet or exercise routine? Losing a few pounds while eating healthier or becoming more active is usually expected. But unintentional weight loss is different. If you continue losing weight without trying, especially along with other symptoms like abdominal pain, poor appetite, or fatigue, it deserves medical evaluation. One possible reason is that problems affecting the pancreas can interfere with digestion. When the pancreas isn't working properly, your body may have difficulty breaking down and absorbing nutrients from food. As a result, you may lose weight even though you're eating normally. However, pancreatic cancer is not the only possible cause. Weight loss can also occur with diabetes, thyroid disorders, depression, chronic infections, digestive diseases, or many other medical conditions. The important message is simple. Unexpected weight loss should never be ignored, especially after the age of 60. Finding the cause early gives you and your healthcare provider the best opportunity to address it. These first 2 symptoms are often subtle, but the next warning signs can be even easier to overlook. Let's continue with the next 3 warning signs. These symptoms can be caused by many different medical conditions, but if they appear without a clear explanation or continue to get worse, they should never be ignored. Symptom number 3, loss of appetite. Have you noticed that you no longer enjoy eating the way you used to? Maybe your favorite meals don't seem appealing anymore, or you feel full after eating only a few bites. A temporary loss of appetite can happen because of stress, a viral illness, or certain medications. But if your appetite remains poor for several weeks, especially when combined with weight loss or stomach pain, it's important to discuss it with your healthcare provider. The pancreas plays an important role in digestion. When something interferes with its normal function, eating may become uncomfortable, and some people begin eating less without realizing it. If you're consistently skipping meals because you simply don't feel hungry, don't assume it's just a normal part of aging. Symptom number 4, yellowing of the skin or eyes, jaundice. One of the more noticeable warning signs is jaundice, which causes the skin and the whites of the eyes to appear yellow. This happens when a substance called bilirubin builds up in the body. In some cases, a problem involving the pancreas can block the bile duct, preventing bilirubin from draining normally. Jaundice may also be accompanied by itchy skin, making everyday activities uncomfortable. However, jaundice is not specific to pancreatic cancer. It can also be caused by gallstones, hepatitis, liver disease, or other conditions affecting the bile ducts. If you or a family member notices yellowing of the skin or eyes, seek medical attention promptly. It should always be evaluated by a healthcare professional. Symptom number 5. Dark urine and pale or clay-colored stools. Changes in the color of your urine or bowel movements may seem like a small detail, but they can sometimes provide important clues about your health. If bilirubin cannot flow normally into the intestines, urine may become unusually dark, while stools may appear pale, gray, or clay-colored instead of their normal brown color. Some people notice these changes before they even develop visible jaundice. Although dehydration, certain medications, and liver or gallbladder conditions can also change urine or stool color, persistent or unexplained changes deserve medical evaluation. Paying attention to these signs may help identify problems affecting the liver, gallbladder, bile ducts, or pancreas before they become more serious. The important lesson is this: your body often gives warning signs long before a serious condition is diagnosed. Listening to those signals and seeking medical advice early can make a meaningful difference. We've already discussed 5 possible warning signs. Now let's look at the final 3. Like the others, these symptoms do not automatically mean pancreatic cancer, but when they are persistent or appear together, they should be evaluated by a healthcare professional. Symptom number 6, new onset diabetes or suddenly worsening blood sugar. The pancreas produces insulin, the hormone that helps control your blood sugar. Sometimes a problem affecting the pancreas can make it more difficult for your body to produce or use insulin effectively. As a result, some adults over 60 may suddenly develop diabetes or notice that their blood sugar becomes much harder to control. You may feel unusually thirsty, urinate more often than usual, experience blurred vision, or feel tired throughout the day. Of course, type 2 diabetes is very common, especially as people get older, and most people who develop diabetes do not have pancreatic cancer. However, if diabetes appears suddenly without an obvious reason, particularly when combined with unexplained weight loss or abdominal pain, it deserves further medical evaluation. Symptom number 7, ongoing nausea or digestive problems. Do you often feel sick after eating? Perhaps you experience frequent nausea, bloating, indigestion, or a feeling of fullness after only a small meal. The pancreas releases digestive enzymes that help break down fats, proteins, and carbohydrates. When it isn't working properly, digestion may become more difficult. Many people assume these symptoms are simply acid reflux or an upset stomach. In many cases, they are. However, if digestive problems continue for several weeks despite lifestyle changes or treatment, it's important to speak with your healthcare provider. Persistent digestive symptoms should never be ignored simply because they seem common. Symptom number 8, extreme fatigue and weakness. Everyone feels tired from time to time, especially after a busy day or a poor night's sleep. But extreme fatigue is different. Some people describe it as feeling exhausted from the moment they wake up. Even simple daily activities, walking across the room, preparing a meal, or climbing a few stairs, may suddenly feel much more difficult. Fatigue can be caused by many conditions, including anemia, infections, thyroid disorders, depression, heart disease, diabetes, or poor sleep. It is not specific to pancreatic cancer. However, if severe tiredness continues for several weeks, especially when combined with weight loss, abdominal pain, jaundice, or poor appetite, it should be evaluated by a healthcare professional. When should you see a doctor? One symptom by itself doesn't usually tell the whole story, but if you experience persistent upper abdominal pain, unexplained weight loss, yellowing of your skin or eyes, changes in urine or stool color, new digestive problems, or ongoing fatigue, don't wait for the symptoms to become severe. The earlier the cause is identified, the sooner appropriate treatment can begin, whether the problem involves the pancreas or another medical condition. Remember, early evaluation doesn't always mean a cancer diagnosis. In many cases, these symptoms are caused by conditions that can be treated successfully. Let's take a moment to review everything we've learned today. Your body has an incredible way of letting you know when something isn't right. The challenge is that many warning signs begin quietly. A little stomach discomfort, unexpected weight loss, feeling tired all the time, or changes in your digestion may seem like small problems at first. Many older adults simply assume these symptoms are a normal part of getting older. But here's the most important message from today's video. Persistent or unexplained symptoms should never be ignored. Today, we discussed 8 possible warning signs that deserve medical attention if they continue or become worse. Persistent upper abdominal pain that may spread to the back, unexplained weight loss, loss of appetite, yellowing of the skin or eyes, dark urine with pale stools, new onset diabetes or suddenly worsening blood sugar, ongoing digestive problems, and extreme fatigue. It's very important to remember that these symptoms do not automatically mean pancreatic cancer. In fact, many people who experience one or more of these signs have other medical conditions such as gallstones, stomach ulcers, liver disease, pancreatitis, diabetes, digestive disorders, or infections. Only a healthcare professional can determine the true cause through a proper medical evaluation. The goal of this video is not to create fear. It's to encourage awareness. When you notice changes in your body that don't improve or don't have a clear explanation, don't simply hope they'll disappear. Schedule an appointment with your healthcare provider. Early evaluation may identify a serious condition sooner, but it may also reveal a treatable problem before it becomes more severe. You can also support your overall health by avoiding smoking, limiting alcohol if you drink, maintaining a healthy weight, staying physically active, eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, and keeping conditions like diabetes and high blood pressure under good control. While these habits cannot guarantee the prevention of pancreatic cancer, they contribute to better overall health and may reduce the risk of many chronic diseases. Most importantly, listen to your body. You know your health better than anyone else. If something doesn't feel right and the symptoms continue, don't ignore them. Seeking medical advice early is one of the most important steps you can take for yourself and your loved ones. Thank you for spending your time with Dr. Bilal. If you found today's video helpful, please give it a thumbs up, subscribe to the channel, and turn on the notification bell so you never miss our latest evidence-based health tips for adults over 50 and 60. If you know someone who has been experiencing unexplained symptoms or has concerns about their health, share this video with them. It could encourage them to seek medical advice sooner. Until next time, take care of yourself, stay informed, and remember, paying attention to your body today may help protect your health tomorrow. I'll see you in the next video.